Hello everyone. Today we are going to discuss about an important disease called Parkinson disease. Actually, Parkinson disease is very important and it's very common among especially old people actually. So now let us dive into the topic. So when we say Parkinson disease, it's a kind of neurodegenerative disease actually. As we have already known, we have many examples of neurodegenerative disease like Alzheimer's, like for example. So this is also another common type of uh, neurodegenerative disease. But unlike the others, the Parkinson disease, the degeneration of the neurons occur in the substantia nigra specifically. For example, so let us see the definition. Is a neurodegenerative disease leading to damage and death, leading to death of dopaminergic neuron. When we say dopaminergic neuron, neurons that are producing dopamine, dopaminergic neurons in the substantia nigra. When we say substantia nigra in English means black substance actually, substantia nigra. So this substantia nigra is actually a kind of something like, if you say this is the midbrain like this. So here we have substantia nigra here. And this side we also have another substantia nigra. So this is connected with the basal ganglia actually. So this dopamine, we have a lot of dopaminergic here in the substantia nigra. So these neurons that are found in the substantia nigra, then they got degenerate. Then if they degenerate, because there is accumulation of about 70% of them, there is accumulation of a kind of uh, protein called, or something substance, or a body called the Lewy body actually, Lewy body in them. So this 70% of the neurons are having Lewy body inside them, Lewy body. So in the remaining neurons, actually they also undergo that degeneration. So that is it, instead of them to take over. So this is what the pathogenesis or the pathophysiology of what causes this degeneration actually. And in some cases, there is mutation in a gene called SNCA gene. So this SNCA gene is the one that is encoding a protein called alpha-synuclein. Alpha-synuclein. We have to remember that in Alzheimer's disease, it is tau protein that is accumulating, but in this Parkinson, we also have another protein called alpha-synuclein. So that is it. So now let us see the symptoms and signs, or the etiology first. Etiology. Especially in most cases, the etiology is idiopathic. We don't know why causes this Parkinson disease, but there are some risk factors like tobacco smoking, like pesticide exposure. That's chemical, right? Pesticide exposure, and there are some kind of drugs that causes Parkinson's like symptoms called Parkinsonism. So that's drugs actually. Examples are haloperidol, chlorpromazine, tioxanthin. So and so on actually. So these are the examples of drugs that causes Parkinsonism actually, Parkinson's like symptoms. So now let us see the symptoms of this Parkinson disease. Symptoms and signs. So for us to remember the symptoms, we have to remember a mnemonic called British. British. But the remaining ISH is smaller because they didn't mean anything in the mnemonic. But the B, it means bradykinesia. When we say bradykinesia, we mean actually slowness movement. Bradykinesia. Kinesia means movement, right? Brady means decrease, so decrease in movement or slowness movement, literally. Slowness in movement. So if there is slowness in movement, so definitely it will affect what? The person will have difficulty in walking. There is difficulty in walking, difficulty in even taking bath, difficulty in even feeding. So this is showing how severe it is, because when we say, even when we are feeding, we have to move our hands, right? So that one is very difficult for them. So we have rigidity, actually. Rigidity. So rigidity means the patient actually is having a kind of resistance to the movement of his limb, which is resistance to limb movement. To even to the extent that there is a kind of decrease in swinging of the hand, leading to decrease in limb swinging when walking. So if in a normal patient, the limb has to be swinging aside, right, when a person is walking, but in Parkinson's disease person, due to this rigidity, actually there is decrease in their swinging of the hand. And on physical examination, you will even see the patient having a kind of cogwheel rigidity. It's a classical for this Parkinson's disease called cogwheel rigidity, actually. So now let us we will discuss the others later, actually, due to space. So limb swinging when walking. So on physical examination, there is cogwheel rigidity. Cogwheel rigidity. So this is very, very classical, actually. So now let us discuss about the eye. The eye means instability, postural instability. Postural instability, actually. So this postural instability, it means the person cannot maintain posture, cannot maintain a normal posture. Normal posture, actually. So that is it. Then we have finished with B means bradykinesia, R rigidity, then I means postural instability. Then this is the I, actually. So we have T. T is supposed to be here. T. So this is the British. Then forget about the ISH. T means tremor. Tremor means shaking of the hands, actually. Tremor. And this tremor mostly occur at rest. And then disappears with movement. Disappears with movement. Actually, so this is the tremor, actually. And this tremor, there is classical form of this tremor, of this Parkinsonism, because we have fine tremor, another type of tremor called fine tremor, some tremor called intentional tremor, some tremor called flapping tremor. But in this Parkinson disease, we are having a kind of pill rolling tremor, because it is the tremor is exaggerated, or it is pronounced more in the thumb and then the index finger, actually. So it is as if the patient is rolling something. So that is called pill rolling tremor, actually. So that is it. So these are the most important classical sign or symptoms of this Parkinson disease. Especially these are called motor symptoms. Actually. So these are motor symptoms. So we have non-motor symptoms or cognitive symptoms, actually. So that is it. Non-motor symptoms. So in the non-motor symptoms, actually, the patient may have a kind of difficulty in solving problems. and also the patient will have a kind of abstract thinking. The patient will have abstract thinking actually, and then also the patient will a kind of actually having a kind of dementia. Dementia is a general term for, is a term that comprises forgetfulness. Forgetfulness. The patient will even forget the name of his wife or the name of his son actually. Forgetfulness, or his even home location. Then forgetfulness. Then we have altered mood. And in this altered mood, actually, it is characterized also. It is divided into three. It may be sometimes the patient will have a kind of depression. Sometimes the person may have anxiety, and then the person sometimes may have apathy actually. So that is it. So these are the cognitive or non-motor function actually. So sometimes there are kind of sleep problem, like insomnia, sleep disorders, e.g. insomnia. And then one thing I forget to mention actually in the motor symptoms is we have a kind of face mask symptom actually, or face mask sign. For example, especially in the because there is decreased or diminished, there is diminished movement of the muscles of the face, so the person will have a diminished facial expression. So diminished facial expression, because we can mean something just without talking, but with using of our facial expression. But this patient with Parkinson's disease have problem with this facial expression, so which is called mask face. So that is it. And also this is very classical actually. Then when we come to diagnosis, how can we diagnose a patient if we are suspecting patient with Parkinson's disease? On physical examination, based on his symptoms, and then physical examination based on symptoms and the physical examination. And if we on physical examination, if you ask the patient to move, so you will actually kind of see the patient having a kind of shuffling gait or fascinating gait. It's all the same actually. So on physical examination, you will see shuffling gait, shuffling gait. It is the something as fascinating gait actually. So that is it. So we have differential diagnosis of this because there are some diseases that can mimic, or there are some diseases that just like they are just like the Parkinson's disease actually. So differential diagnosis, DDX. So we have to really differentiate it from Wilson disease. We have to really differentiate it from Huntington disease. Huntington disease. So that is it. Then we have to differentiate it even from a kind of disease called Shy-Drager syndrome. So these are the differential diagnosis of Parkinson's disease actually. So now let us see the management. So now let us see the management. So for the management actually, or the treatment, the patient, in this disease actually there is no single drug that may actually reverses or arrest the degeneration, but only it can relieve some of the symptoms actually. And the most appropriate and the best therapy for it is kind of drug called levodopa or L-dopa, levodopa. So this levodopa, it has to cross to the central nervous system where it's going to be activated. Then it will mimic just the action of dopamine actually. So it will substitute dopamine, right? So that is it. And then for us to have a kind of prolonged time of this dopamine action is we have to administer it with, that is plus, a drug called carbidopa. And this carbidopa is a kind of dopa decarboxylase inhibitor. So we have to administer levodopa plus dopa decarboxylase inhibitor. Dopa decarboxylase inhibitor. So example of this drugs is carbidopa. So that is it. And then sometimes the levodopa is also administered with a kind of drug called the catechol or methyl transferase. Also called COMT actually. So all this we are combining the levodopa in order to decrease its breakdown, that is its metabolism, so that it prolong the action of this levodopa. This drug inhibit or decrease its metabolism in the central nervous system, while this decrease its metabolism in the peripheral, that is peripherally, that is before the central nervous system, that is not inside central nervous system actually. So this is the end of the Parkinson's disease lecture actually. Thank you very much.